URAC webinar, Telehealth Quick Take, Health Centers Providing Service to Communities and Meaning to Providers. This is going to be a quick little webinar. Looks like we've got about 30 people who've already filed in. We're very excited to have you here with us today. Go ahead with the next slide. Today, it's going to be me. I'm Dr. Sean Griffin. I'm the President and CEO at URAC, and we've got Clint Shackelford, who is the Chief Operating Officer for the West region for ARcare. We're going to get to share some of Clint's experiences as he has gone through accreditation, and it's a great organization to work with. And not only is it a great organization to work with, but they're kind of a neat group. And so we really wanted to have them on here, and Clint has been really helpful in working with us. But we've got a few slides to go through and some questions. So good to see everybody. Before we get started, we've got Nick Davis working in the background for any technical issues. You can message him if you're having any problems. Please use the chat box for any questions and to introduce yourself, and we'll be throwing resources into the chat box as we go along and talk about things. So on this day that's a little overcast here in DC, we'll go ahead and get started. So next, please. So the agenda for today, we almost have more divisions than we do have minutes to this webinar, but we're going to talk about URAC really briefly, talk about ARcare. We're going to talk about how ARcare serves the community, how they work on maintaining staff loyalty, where accreditation fits into all of this, and then any questions or insights that the audience wants to share, happy to do that. So a little bit about URAC, got to say who we are. We are a national accrediting organization. We're a not-for-profit. We're based here in Washington, D.C. We've been around for over 30 years. Most organizations that work with us know us through our specialty pharmacy accreditation and our multiple pharmacy accreditations, although we also are the leading accreditor for telehealth and remote patient monitoring programs. We work with everybody throughout the healthcare system, everything from little organizations to huge organizations, from pharmacies to PBMs to hospital systems to telehealth providers, both in the US and across the world. We have 40 plus accreditations. The last time I heard a number, I think it was above 45, but we're always looking to be innovators and work with different areas. Howdy to Shirley Hinojosa from TriWest, as you put yourself in the chat box, and Courtney from I wonder if that's Ally, Align, and Curana Health. Okay. So good to see all of you. And with that, I think we'll move on now. So I'm going to turn over to Clint. Clint, if you want to turn on your camera and let's talk with the people. Clint Shackelford from ARcare, and I'll let you walk through your slides, Clint, and I'll drop off, but I'll come back at the end of your slides, okay?
Hey, perfect. Good morning, everyone. It's an honor to have the opportunity to come and talk to several of you out there about what we do and how we do it. And also, I consider URAC to be one of those friends, although we are accredited in our telehealth and in our pharmacy world. They've been great to work with, so I do want to point that out. So a little bit about ARcare is that we started with one doctor who's still our CEO. Over 40 years he's been with the company. And we have expanded now to approximately 75 clinics. We grow so fast, sometimes I need a clicker to keep up. Just today, we opened a new access point in Malvern, Arkansas. But we're in 3 states. We're in Kentucky, which is Kentucky Care, Mississippi, which is Mississippi Care, and also ARcare, and of course, the other 2 are doing business as ARcare. We have 1,300 employees, and last year we had 1 million, what we call touches, in our company with over 100,000 unique patients. So we really are making a difference. You can see from our map that we are really clustered in central and north and northwest Arkansas. And now we're expanding down the I-30 corridor towards Hot Springs. So we're growing. Next slide. Thank you. I'm going to talk today, and I think our mission is what drives us. If you notice, it's health for all. And that's just what it says. Irregardless of a payer's means to pay, a patient's means to pay, we're going to take good care of them just as we would with someone with the best insurance in the company. No one's turned away. That's another motto. And then you're also going to hear today, probably again, that we kind of have an internal motto that we're here to serve the least, the last, and the lost. And as an FQHC, obviously, safety net providers, we take that to heart, and that we really beat that drum with everything that we do. It's kind of neat to kind of piggyback off our growth, but I've been with the company 7 years, and when I started, we had 500 employees. So in 7 years, we've almost tripled our size. And when I started 7 years ago, we had 35 locations, and as I mentioned, we're up to 75. So I think we've got the secret sauce, and our providers are really the drivers behind what we do here. So yeah, really great to see our growth. Yeah, I mentioned already a little bit, but we served over 100,000 unique patients in 2022, and we're on pace to exceed that this year, obviously with our growth. So super excited. This is Mr. Jimmy, a patient that I actually know, that allowed us to share his story. So really neat to get personal with your patients. You know, we have all the typical services that any healthcare entity our size has: coordinated care, remote patient monitoring, diabetes education, all forms of clinical services. But I think what also makes us a little bit unique is that we bring other services to patients that, you know, without these services, it doesn't matter what kind of health system you've got, patients need to be able to understand insurance and find kind of someone to help them navigate that marketplace. Transportation in rural Arkansas is a huge barrier that we continue to stay focused on. Just last week, we had a lady give us a van, a 7-passenger van in Northwest Arkansas. We shared our story with us, and once again, here's another van comes into our fold in a region. Our employees have a workplace wellness program, which helps retain employees. We also bridge so many rural gaps with our telehealth program. There are little small towns around Arkansas that I would be confident that most of you have never heard of, but it's so often it's hard to justify the cost of putting a provider in a very rural location with 100 person population, but we can suffice and take care of those folks via telemedicine. And then, of course, we also do have pharmacy services. We have 14 retail pharmacies, and we have a 50-state accredited mail order pharmacy. So a lot of services that our patients need at their fingertips.
So Clint, thank you so much for that overview. You know, when we think about an FQHC, you know, the pandemic, you know, threw everything up in the air, and you guys continued to provide services. What was that like for you guys? What was it like going through the pandemic and delivering services? How did it expand what you're doing? How did it change what you're doing? And then what's it looking like as we come out of the pandemic?
Yeah, you know, I probably used this word before, but when the pandemic hit, it was kind of the Wild West. You know, every day something was new, and there was a new hurdle, be it how do we get vaccines from one location to the next, employees, and talking about quarantines. And, you know, so what probably I gathered the most from the pandemic is how outside companies and other organizations realize the need for a healthcare partner. I think so often, I'll use schools as an example. You know, schools have a school nurse or two that takes care of the intricacies in the building, but suddenly schools are saying, oh my gosh, you know, we need a CLIA waiver. We need to be able to perform these Binax tests for our staff. So, and that is just one example, but homeless shelters came to us just in desperation of needing partners. And so I think the biggest thing I saw was an educational moment for kind of the communities at large about the importance of having a healthcare relationship.
Well, yeah. Clint and I, you and I have talked before about this. By the way, if people on the webinar have questions, just type them into the chat box. We'll gather those up and we'll share them. I have a couple more questions for Clint. You and I have talked before about this. I'm from a small town in rural Iowa, and I remember the community, and I've been back there times. It can be really tough to find staff to work in these towns. How do you find staff, and how do you keep the staff that you have?
You know, we constantly recruit. I will tell you, we have a very strong HR and marketing department that I think really sells our brand. We are ultra transparent with what we do and who we serve and our mission to serve. And I think it really starts with that. People knowing that you care about patients and you're going to do everything in your power to help them. Now, from a retention side of things, you know, we do some kind of unconventional things, but every employee will get a turkey this year at Thanksgiving from ARcare with a little bonus. And the logistics of getting those turkeys delivered, but you know, something as minor as that, our employees go, hey, they care about us. And we do task even our senior leadership, myself included, with developing relationships with our employees, be it a medical secretary, be it a nurse. I'm in a clinic right now, and I've came in, I've met and greeted and asked, what do you need? Is there any problems? So I think we put a very personal flavor and an expectation for our leaders to have that personal flavor. So that's some of the secret sauce, because everyone knows FQs aren't the best pay in the country. I mean, we certainly can't compare with our hospital counterparts, but we have to do it with passion and real vigor to prove that we care about our people.
I do want to put a little bit of a plug in here about accreditation. Clint, one of the things that I talk about is that when we go through accreditation, we don't sell consulting services. We don't sell you a bunch of hours and an accreditation. We talk about it's meant to be educational. It's meant to bring best practices into communities who might not otherwise experience it or see it. Tell me what your view as to how the accreditation experience was for you guys.
Yeah, you know, I call it divine intervention, as it may have been, but we started really pursuing a telehealth program just before the pandemic. As a matter of fact, January before the March pandemic outbreak. So what we found quickly was that all of our policies and workflows were great for a clinic setting, brick and mortar. So we knew quickly that we were going to have to do something to get us, you know, out of a silo of clinical, and how do we embed the telehealth side? And because our pharmacy services were URAC-accredited, and we knew that was a worthwhile pursuit, certainly with plenty of accolades and experience, we jumped in. And I mean, I'm telling you, you guys were super to support us. The questions we had were probably elementary when we started, but really what it did is it helped us align and overlay how we can complement our brick and mortar services with our telehealth services. And now we're 3 years accredited and getting ready to be reaccredited, we hope. So we're looking forward to going back and reflecting on what we've done since our initial accreditation and putting together even a stronger package to present to you guys about what we do in our telehealth program.
One of the things about your program, and you and I have talked about this multiple times, and we're very excited about it. You know, we believe in highlighting organizations that are doing things differently, and we work with so many different organizations. When you work with a community, talk to me about the community resources that you tie in, the community, you know, organizations and those sort of things that you work with in these communities.
Sure. You know, one of the first things we do is we try to go meet with a small town mayor. Nobody knows better about what a community needs than a mayor. And those mayors will talk to us about services that they have that are available. They'll talk about needs that they have. And we'll try to just start there about a strategy and an approach to help the community. We believe our secret to success and why we've been able to grow multiple clinics in some of our larger communities is that we partner with that community. Maybe it's the school district that we go into, and often we'll offer telehealth services to them. The school district will do a purchase service agreement with us for a nurse. They love having that extra nurse when one of theirs is out. So that's an example of us, you know, just doing a pass-through money type approach to give them a nurse that they need. We see that a lot. We'll go into women's shelters or homeless shelters, and we'll dial in twice a week and do telehealth for those folks that, you know, we'll bring a van into those locations to bring those more complicated patients into our brick and mortar settings. So I could go on and on about all of the different partnering approaches that we take. But if your community doesn't know who you are and trust who you are, and then point out access to care being the biggest probably hurdle that so many of them don't understand, how to even get in the system, how do I pay for it if I don't have insurance? So I just think it's being very community oriented.
One of the things that we face here in Washington, D.C. is we talk with legislators and we talk with regulators about what's going on. And sometimes they have a really small view as to telemedicine and those sort of things. And these are the groups that are writing the rules and passing the laws that determine how you function as an organization. And one of the reasons why I came to URAC was the idea that I could share these experiences with the people before they write a law that messes things up. But we've seen a changing legal landscape coming out of the pandemic, and regulations have been reapplied and they're adjusted by state and those sort of things. You work in a couple different states with your organization. What are you seeing sort of as regulations and rules have come back on licensing and prescribing restrictions, all that sort of stuff? What do you see?
I think I've used this word before, but we're kind of watching some where the genie's going back in the bottle. I'd mentioned that when the pandemic was the Wild West, we're seeing some more regulation. Obviously, now you've got to use, HIPAA compliant platforms versus, when we were so acclimated and so easily dialing up with FaceTime. So we're seeing some of that scale back. But I'll tell you one thing that I don't know that can ever change is the public appreciated telehealth. And I think that's going to stop the genie from going all the way back into the bottle. I think that we're going to see more legislation easing some of the restrictive type approaches. Now our providers don't have to be in a clinic setting. There's just so many differing rules and regs that have got some permanence even as traction from, the pandemic's heights.
So we talked about the Wild West, sort of everything happened with the pandemic, and it was sort of like this, whatever you need to do, whatever you need to do. And now the restrictions are coming back on. One of the areas where I really think that people need to appreciate is access to mental health care and telehealth and being able to deliver behavioral health and the related, substance use disorder and medication assisted therapy and all those sort of things. How has that gone for your organization? How has that played out for you?
Yeah, we've really grown during the pandemic because obviously, one, the need for behavioral health services, but we can take care of our patients in our MAT programs via telemedicine very often without them having to get into that. And I will tell you that sometimes they're not the best to show up for appointments. So it's an alternative to get them what they need sometimes without, them coming into the clinic. So our telehealth services have been super to bolster our behavioral health program. And, we're pretty new to behavioral health, but I would say that, you guys know as well, telehealth's been in behavioral health forever. Getting it into the primary care side of things was really our biggest challenge, hence why we came to URAC. I do have to say one thing, though, that we've got to figure out and get better at is that quality measures struggle with telehealth. And when I talked about the height of the pandemic, and we're seeing 55,000 telehealth encounters in 2021, we suffered some from the traditional UDS quality measure performance because we can't do that A1C when that patient's at home, and we can't get that BMI and all those measures that are really driven to a brick and mortar type measure. I think we need to try to figure out how do we grow telehealth to help us with those quality measures, be it, some of these remote patient monitoring devices and things that we're getting and trying to implement. I just think we've got to be able to fold that technology in to continue to grow telemedicine.
I do want to encourage everybody who's on the webinar, if you have any questions or just thoughts that you want to throw into the chat, we would appreciate them, because otherwise I'm just going to keep talking to Clint, and I'd rather hear what's sort of coming up from your guys in your view and that sort of stuff, so we can highlight things that are meaningful to you. You're talking about measures, and I'll tell you, I get questions all the time about what are the right quality measures for telehealth and how do we demonstrate the value. When you're sitting here in Washington, D.C., and when you talk to people, there's really sort of two main camps over on the Hill is the way that I describe it. There's the group that says, oh, this is about access and improved access, and it'll talk about those sort of things. And there's another side that's concerned about the fraud, waste, and abuse, and is this money being well spent? And what I say is, first of all, when you talk about measures, we need to understand that it's not one size fits all. Okay, when you're talking about telehealth, telehealth has 40 different care delivery systems within it, whether you're talking about behavioral telehealth. Any measures you pick for behavioral telehealth probably are not the same as you'd pick for pediatric telehealth or some other telehealth. And so thinking that it's going to be one size fits all and there's one set of measures, we're not seeing consensus show up on what are the right measures for telehealth. Now, we work with really big organizations, and one of the things that we try and do is we try and talk to organizations and say, what are you capturing, trying to demonstrate the value? Because anyone delivering telehealth these days needs to be able to articulate what is the value. Is it service in a town that would not otherwise have providers? Is it support for a school that would not otherwise have the staffing ability? Is it medication-assisted treatment? Is it more doors for psychology, for psychiatric help, those sort of things? So, we're happy to share with you experience of what we see. We just know that telehealth is really a complicated, nuanced environment, and so it's not going to be one size fits all. Clint, you talked about working with the mayors in these small towns. Walk me through a little bit of what is the conversation? What do you say you're going to bring to the table when you talk to a mayor in a small town?
Well, I'll tell you, anytime before we go in and open a clinic in any community, we go in and try to develop community partners, right? So our first strikes are the mayors and maybe some other dignitaries if they happen to be, from that local area. And we just come in and we sit down with them and say, here's the full gambit of services we offer. Pick out what you think would be the top 5 things that you need in this community. And I'll tell you, it doesn't take a mayor very long to start asking for things. I mean, I'll tell you, they're good at that. I mean, and that's how that works. But really, a good mayor has a pulse on his community. And so often we probably hear transportation in rural Arkansas is the biggest barrier. We'll hear things like, we need someone to come in here and stay. A lot of these small towns have had clinics pop up. The patients utilize them, and then the next thing you know, the clinic's not feasible and they're up and gone. We've never closed a clinic. I think I need to say that. I think that's a pretty big statement with the number that we've got. So that's one, probably the 2 biggest things are stick-to-itiveness and transportation in rural Arkansas. Now, in a lot of our bigger settings, especially lately, it's been Suboxone treatment, MAT therapy, huge opioid epidemic in the South. I know it's across 48, continent of 48 here, but we do have a lot of issues with that. So a lot of those dignitaries will ask us for those services. And then I do think one other thing that's very important that I state here is that while we may go see the mayor, the first rattle out of the box, we always try to go to the regional hospital system and meet with their leaders when we come into a community. One, we need their partnership, obviously, for the specialty services they bring. But very often, too, they can tell us that, hey, we don't have a rheumatologist in town. Hey, we don't have a psychiatrist in town. Do you have an option? And very often, and I picked those 2 because we do happen to have the rheumatologist, and often we'll use telemedicine to spread his skill sets out to the communities all across the state. So just an example of trying to find a niche that's not filled in that community through people that would know.
Yeah, I really appreciate that. And, this is dear to my heart from my background. I think that, when you grow up in a small town, you understand the differences. And I was on a call a few months ago with an organization here in Washington, D.C., and they had another doctor on this call. And this doctor was labeled as a rural health expert. And we were talking for a while, and this doctor was saying some things that I'm like, I'm not sure where you're getting your experience here. And so I said, where do you practice? And they said, well, I practice in southern New Jersey. And I said, I'm not quite sure that Southern New Jersey is truly representative of the rural Midwest or those sort of things. And so being able to communicate and articulate and share your experiences is incredibly important. So to anybody on the call, if you're working in any area, please share it with your state legislators, your mayors, your Congress people, your senators, because them hearing from their constituents really helps to open the doors for the freedom to do the things that patients need. And I would just encourage everybody about that. Now, Clint, you're coming to our URAC-Connect conference
Yes,
that we're going to be
looking
having
forward to it.
in DC. To those of you who are on the webinar, if you haven't had a chance to sign up or look at that information, go to our website. Lisa, I think we may have a slide with some of the upcoming conferences that we may throw up back here just to see that. But really appreciate Clint, you being here and you sharing your experiences. These are upcoming webinars, and by the way, Lisa behind the scenes is a huge fan of QR codes. So the more you guys click the QR code here on this, the happier Lisa will be. On Friday, September 8th, co-host with American Telemedicine Association, URAC Focus on Quality for the Next Generation of Healthcare. We're going to have Ann Mon Johnson from the American Telemedicine Association will be on with us, and then a special one on pharmacy standards for patient safety, Friday, September 15th. But click the QR code. Also, Nick has the link to URAC-Connect in the chat box. Clint, is there anything that you want to say just as we sort of wrap this up?
Hey, listen, healthcare and getting it to people that need it in rural America is pandemic has really pointed out how that need is there. We've got to keep pushing, as you mentioned, and lobby our legislators to continue to ease and make that connectivity easier. I think that's the pulse of where we're headed, but I think that everybody on here needs to champion for those rules to be perpetuated.
I want to highlight the Friday, September 15th conference that's up there. That's going to be another one of quick takes, just a little webinar like this where we just sort of highlight things that are going on and highlight organizations. Also, if you or your organization is URAC accredited and you think you have a great story to tell, reach out to us. Reach out at education@urac.org. Let us know what you're doing and what you think is worth talking about. We really care about the organizations that we work with. We say that we do this because by highlighting you, we can highlight the care that you're delivering to your communities. And that's really important to us. And Clint and the team at ARcare, just thank you so much for the work that you guys do day in, day out under sometimes difficult circumstances. And thank you for all the communities that you found a way to serve with what you're doing. So, and thank you for taking time out of your day to be on here with me. And I